The report's wrong.
No. Who could do that? Yeah. Even organizational, your note taking, like. No. To order Indian County Hospital District Board of Trustees meeting on February the 19th at 4 o'clock. Here we are. Frank, invocation, please.
Yes, Madam Chair, happy to. If everyone could bow their heads, please. Let's take a moment to pause and center ourselves in gratitude. We are grateful for the opportunity to serve, to steward resources, shape decisions, and work together for the health and well-being of our community. We recognize the trust placed in us and the responsibility that comes with it. May we be guided by wisdom in our discussions, clarity in our choices, and courage in the moments that require difficult decisions. Help us to remain focused, not on what's easiest, but on what creates lasting impact. Let our work today be marked by respect, collaboration, and a shared commitment to improving lives, especially for those who need it most. May we listen openly, speak thoughtfully, and move forward with purpose. And as we leave this room tonight, may the decisions we make ripple outward in positive ways, strengthening families, improving health, and building a healthier future for our community. Thank you for the privilege of this work and the people beside us who make it possible. Amen.
Thank you. Would you believe?
Of the United States of America and to the
republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Dr. Mackett, you have.
Yeah, thank you, Madam Chairman. I just wanted to disclose before the proceedings tonight that I do have a conflict. I am a medical advisor to the Board of Directors for the Caring Center for Women. I've filled out my Form 8, and at that portion of the meeting, before you start, I will recuse myself and leave the room.
Thank you.
Okay.
Understand. All right, moving on to our consent agenda. I'll ask for a motion to approve the chairman's meeting minutes dated January the 15th, regular monthly meeting minutes dated January 16th, and a February disbursement of $2,093,465.69.
So moved.
Second.
Any discussion? All in favor?
Aye.
Aye. Thank you. Moving on to reports, I'm going to skip over myself and just move to Jennifer.
Okay. Thank you, Madam Chair. It's been another busy month with the district. And leading off on what Dr. Mackett just indicated, our monthly meeting packets now contain a copy of Form 8B, which is our statutory memorandum of voting conflict. And so for a board member, if a conflict does arise in a meeting where a trustee needs to recuse him or herself, in accordance with our conflict of interest policy, you will always have that form on hand and available to fill out. Our attorney's overview is also included, which includes a very good summary of our practices and procedures in conducting district public meetings, and also sets out the parameters for public comment. With feedback received from the trustees this month, discussions have been held with VCOM with the goal of reaching agreement on the amended contractual deliverable requirements in Section 4 of the lease. Based upon the foregoing, we're preparing for your review and approval an updated proposed lease amendment by and between the district and the VCOM, as we did discuss a little bit more in depth yesterday at our chairman's meeting. So that will be forthcoming for your review. Discussions have been ongoing regarding V&A's request to connect to the retention pond on the parcel owned by the district and leased to the Cleveland Clinic. Meetings have been held with relevant stakeholders to discuss the request and potential implications. A memorandum had been circulated outlining the details and options the board may include in their evaluation and decision on this matter. So we're continuing to work through that, and we'll have more to bring forth on that, possibly by next month as well. In the past month, we've commenced a review of all current contracts and leases to which the district is a party and are compiling all deliverables in a streamlined manner to be tracked throughout the pertinent contractual terms. This exercise will aid our office as well as the district's office in ensuring contractual compliance and timely implementation of change management when required. Also in the past month, we've teamed up with the district staff to review the various district policies that have been coming before the board and procedures to determine if updates are required and the plan to implement these updates. We are continuing to work with district staff and the board also on the 10th Street property matter, which will provide support as requested as this matter moves forward in whichever manner the board does elect to do so.
Any questions, council? Jennifer, thank you very much.
Thank you.
Appreciate you. Michael Kent, our financial statements.
Fellow trustees, we're now 1/3 of the way through the district's 25-26 fiscal year. I am very pleased to report that the district's financial position continues to be very strong. To review or overview the January financials, as usual, if you'd please turn to the last 4 pages of the financial section from your board packet. Those 4 pages back from the end, you'll find the 1-page financial snapshot. That's of the district's cash and investments. At the top of that page, you'll see that as of January 31st, the district had received $22,262,875 of ad valorem taxes. That represents 89.7% of our anticipated ad valorem tax budget. Moving to section 1 of the snapshot, you'll see the district's United States Treasury holdings. On January 21st, our T-bills totaled $15,545,032. As always, the last column on the right shows how they are staggered in terms of their maturity dates between now and November. And the T-bills were earning at that point in time an average interest of 3.575%, which was slightly increased over last month. Section 2 details the district's holdings in our money market account, the preferred deposit pool. And at the end of January, it held $5,253,106. It was earning 6.53%, which was slightly less than last month. Section 3 shows our holdings in the local bank account, which was on that date, January 31st, $791,228. Altogether, 4 months into the fiscal year, district investment and cash holdings totaled $21,589,366. And you note there that 99.2% of those holdings were in some form of allowed investment. Frank's really doing a hard job, a good job, great job on making sure as soon as we've got it in our control, it is in some account growing. Okay, let's take a look at the district's expenses by turning the page to page 1 of the year-to-date expenses versus budget spreadsheet. Were all programs being funded equally? I always throw this out just so you've got a benchmark. All expenses would be at 33.333%, but of course they are not. As you look through the funded programs, you will see that the first 2 continue to be at 0. Those are the low-income pool payments. It's about time, I would say, in the next month or 2 that will be invoiced for those. It's not out of the norm. It's always late in the year when those finally get paid or partially paid. Perusing the other programs, you'll see variations above and below the 33% benchmark. As you know, Women's Care Center, which at 76.1% is the agency with the largest program expenditure of their approved budget, is on today's agenda, and they'll be seeking some additional funding. And you may have other questions, I'd be happy to answer them. But if you move just to the middle of the last page of the spreadsheet, just to see the totals for the program expenses at the end of January, they were $7,349,484. That represented 33.1% of the total program budget as approved. The bottom page of that last page of this spreadsheet shows our admin expenses. And you can see that the total administration expenses through January totaled $590,834. That is 41.3% of the approved budget. And combined program and admin expenses totaled $7,940,318, which is 33.6% of the budget. As a point of comparison, I always give you at this point, last fiscal year, our expenses were at $6,004,358 and 29.7% of last year's budget. Since our last meeting, the Finance and Audit Committee has not met. It actually met the day before the last meeting, and we are scheduled to meet again. We've had some fine tying down a date, but we've got one on March 16th, which will be just before our March meeting. We've got a couple of issues to chew on that you've directed our way. We've been looking and discussing one of them, and we got a new one yesterday. But I will be reporting all of our feedback at next month's meeting. Madam Chair, that concludes my report, but I'd be happy to attempt to address any questions the trustees might have.
We keep giving the Finance Committee jobs to do because you're doing a really good job.
Yeah, I'm sure they all appreciate it.
Dr. Mackett?
Yes, thank you, Madam Chair. Thank you for that great report, Trustee Kent. This question is directed to you, but really to staff. So as you noted, there are several of the fee-for-services paid agencies that are running ahead of their budget lines, and I know we are in communication with them. Do you feel that there are any of those organizations that really are trending increased volumes that we may have to address before the end of the year?
Yes, in fact, that is part of my update, my staff update. Do you want me to give it to you now or when I get to my
If
report?
it's convenient, Madam Chair.
Can I just read my
Yeah.
report? Okay.
Go right ahead.
Okay. So, and I did write it so that I don't leave anything out, but following the Q1 volumes, we did, Shannon and I both met with all the community partners whose budget was trending upward. And we reviewed the fee-for-service rate alignment, standardized encounter definitions, and assessed annualized funding sufficiency. So we kind of made some projections out based on the Q1 to see where they would fall and if they were going to be going over their budget. We spoke to them. We found that agencies are experiencing increased encounter volumes due to underinsured, narrow networks for insurance, and marketplace limitations. So yes, to answer your question, they are seeing more people through the district, because of they're not having the insurance that they either had before, or it's just not covering what the services that they're looking for, like mental health are some of the services. So they're relying, more on district funding. At the same time, encounter volumes were impacted on Q1 by seasonal factors, meaning, holiday schedules, not as many days that they were in service for clients. They had some workforce shortages and onboarding credentialing delays, creating variability under the encounter-based reimbursement model. We went through encounter definitions to ensure that we're tracking them correctly and that each encounter is what it should be based on their reimbursement model. And let's see what else. So overall, we found that the fee-for-service model is functioning as intended. However, rate analysis identified both under and over reimbursement across select service lines. These fee-for-service rates have been adjusted. We've made some minor adjustments to them. So you'll see that we'll see that in the January invoicing, which we just paid. And then we'll revisit all of these agencies for Q2 to see how we're doing with those adjustments that were made. It's also important to note, though, that some of the agencies that are reporting lower expected encounters, they shared their concern that the declined volumes might be misinterpreted as performance issues without, proper context. And really, it's more of a matter of this is the first time they had to make these projections. And so they just didn't know. They did the best projections they could. And so they're seeing that waving right there. Now, if you have specific questions, we do have some information on, specific agencies.
Okay, thank you for that, Jennifer. That was a great explanation. I'm just wondering, is it too early in the fiscal year to determine where those trends are headed? Only because we've set our reserves, and it would be better for us to know sooner rather than later if there will be a meaningful fiscal impact of these trends.
Well, I think if you look at their overall, like a lot of these agencies, like Trustee Kent had stated, overall their entirety of their budget, they may be over on one service line, but their entirety of their budget is sometimes in line. But this has been very helpful for the agencies, especially at this point in time when they're getting ready to fill out an application and prepare a budget for their next fiscal year. This has been very helpful, but I don't see where, I don't know how to answer that as far as, what our projections are now. We'll see at.
Yeah, Jenny, you
more
said that very well. Dr. Mackett, let me just add that there's nothing right now, we literally talk about this every day. There's nothing we're seeing on the horizon, any trends that would have any material impact on our reserves. There's nothing saying, oh my gosh, we're going to be 4 million over or something like that. There's nothing like that. So as of now, and we're going to have within another month, after March 31st, we're going to have 6 months of data.
Right. And again, just following up on what Trustee Mackett said, I think we'd much rather not have to deal with this in months, 10 and 11.
Exactly.
Which kind of happens more often than it ought to. We've got an ability to track now.
Right, and if you look at these percentages are really helpful because I went and put tick marks next to mine, and you'll see that their agency subparts of budgets that are really small pieces of their overall budget, so that even if they do happen to blow up, it's tens of thousands of dollars, not hundreds of thousands of dollars.
So we'll continue to monitor.
We will, Dr. Mackett. It's a great question.
I had a question,
Yes, Dr. Finney.
just for information purposes only. I don't think Karen would need to leave, but under senior resources, for information, maybe Jennifer would comment, what happens when a program such as the Public Guardian Program runs out of money?
So that program specifically, they exhausted most of their budget in October intentionally to cover the wards that they already had under their care. They had 20 wards under their care at that time, with the budget that would cover 21 and a half. So that was a discussion we had with them and had agreed to just pay for those 20 wards under their care in October to suffice their public guardianship throughout the fiscal year. And if they have one more at any point in the fiscal year, that will be at their budget.
I see. And also under senior resources, there was I forget the terminology, but a fall bracelet or necklace. I don't see that mentioned, and I don't know where the future of that is.
Are you
That's
talking
the-
about the
Huh?
emergency alert response?
Yes, emergency
Yes,
alert.
mhm.
That's one of the line items in the programs of their senior resources.
Years.
Years, yeah.
Mhm,
Oh, that's what that is.
Yes.
Yes, sir.
mhm.
Emergency alert response
I
system.
know what that abbreviation is, but thank you.
You're welcome.
Any other questions? Seeing none? Frank, Executive Director's report, please.
Thank you, Madam Chair. So just to lay out the structure, I'm going to give a couple updates. I've got a couple updates from the staff, and then I'm going to read our impact story for the month. So I had the opportunity to attend part of the legislative session in Tallahassee this year, and we went with a group of local leaders. It was a great meeting, and Trustee Deagle, I thank with her guidance and just introducing me to a lot of folks up there and helping me understand how to navigate it a little bit better. One of the contacts was a very valuable contact she made an introduction to, who's a key lobbyist in Tallahassee, and he's working right now contracted with VCOM, so that's going well. I wanted to give an update now. There's nothing material to state right now on property tax reform, but I wanted to explain, I just want to walk through and just give a little bit of information about one of the items we looked into in terms of the impact and how future legislation could affect us. So I just want to speak to that a little bit. So obviously there's uncertainty about what's going to happen next, and Trustee Jones and I did meet with the Indian River County Appraiser's Office, and they were fantastic. We wanted to better understand the historical trends. We have records at the district back to the mid-90s, but we wanted to get a good understanding of the historical trends and the annual fluctuations we see in gross taxable value, because that is the foundational number for which forms the basis of our tax assessment. So there's two primary variables that we're watching closely. One is legislative actions that could reduce property tax value, which is happening now in committee. And then the second is a significant slowdown or halt in residential and commercial construction within the county, because that's the value, the gross taxable value is generated through all the values of residential and commercial properties in our county. So over the past, and just I'm going to give you some data on that. Over the past 3 fiscal years, the gross taxable value has increased by an average of 11% annually. It's a pretty big number. So if we look at a longer 10-year period, we're looking at an average annual increase of about 8%. A lot of people are moving to Florida. There's a lot of building down here. We all know that, both commercial and residential. However, during the 5 fiscal years following the global financial crisis, and granted, this is a rare occurrence, but it does happen, which was for us, fiscal years 8 and 9 through fiscal years 12 and 13, the gross taxable value declined by an average of 7% per year. And the point I'm making with this is that if you look at the historical context, it reinforces the fact that we're really forward-thinking with our reserves. It's important. So we also wanted to clarify the relationship between market property values and overall gross taxable value, because I think it's easy for the community and public to get confused on this, and I just wanted to make it a little bit clear. So regardless of the property values, your property values on your home from a market perspective go up and down. But given all the development happening in Indian River County, and whether you're driving down 43rd or up 58th, I mean, anywhere you look, you're seeing these big developments being built. As long as those developments keep being built, there's more homes, there's more commercial properties. Our gross taxable value, should continue to rise, even if market values are flat or decline. So the main message here is that the measures we're looking at are independent, but they're also related. And with new construction and additions to the tax roll, that drives gross taxable value growth, even when the market softens. So regardless of what happens to the housing market, as long as we keep construction and keep developing, the gross taxable value should increase, save an experience that we had with the global financial crisis. Let's hope we don't see one of those again. So, at least not for a long time. So we've got a couple reports I'd like our team to give. But before that, any questions on what I just mentioned, trustees? Okay. So let's see, Jenny, I think you spoke your piece, or you have something else to add?
I do have.
Please do.
I did want to just add about our LOI process that is
Sure,
underway
sure.
right now. So the deadline for submission is tomorrow at 5 p.m. through the EC Impact. And we have received 3 as of right before I came here. I checked again, and we have 3. One is from a new agency that we've never funded before, and 2 other programs are from agencies that we are currently funding. So that's what we have right now.
Jenny, how many are actually, did Nate say are in the process?
Yeah, he said that they've been opened, about 11, but I've also received emails from people, like 2 of those agencies that have opened it that asked some questions and not sure where they're going at this point.
Okay. All right. Thank you.
I'll give you an update later.
Great. Caitlin, if you please.
Ready? Yeah.
Well, while Kate gets the website up, I just want to mention, I had sent an email out earlier with our impact report. So we finalized that. I sent it out in a PDF version, but it's also on our website and it's all formatted nicely. It's not just a download. It looks pretty good on there. And then it does link to the past ones too. So if you want to go back and look the last 2 years since we've started doing the digital one, they're also on there. And I did want to mention with the impact report, what we're trying to go for is showing like the success stories and the impact that we're making in the community rather than just showing the numbers of how much money we've dispersed. You know, we're trying to really highlight all of the good things that all of these organizations are doing. So our impact report has been trying to move in that direction so we can show real stories of what's going on in the community. So if there's any questions about that, anything? Okay, so let me go to the dashboard. As a reminder, it's on the impact tab on the website under healthcare needs data. All right, I'm gonna make it full screen, so. There we go. Can we move it?
thing right there, yeah.
Hide it.
Hit the
Oh.
wrong button last time, so.
Okay, that's fine. All right, cool, we got it. All right, so now that we're 4 months in, I think we're finally kind of starting to see some trends rather than just like single points on the chart. We can tell from that first month, it was a little bit higher. I think everyone was still trying to figure out how this fee for service was gonna work. And then as we've dialed in, I think it's gonna start getting a little bit more steady. We're averaging around 20 to 21,000 encounters every single month currently. So by the end of the year, it's going to be probably several 100,000 encounters, which will be really interesting to see. And we've mostly been able to track unique individuals, which I think is great since previously we've only been able to track through the portal. So now we're getting all of the agencies. And we're sitting right around almost 13,000 unique individuals, which is really good to see considering the portal is about 4,000. So we're reaching a lot more people than we really were able to tell before. And it looks like on average, if I can get it to click, I've seen it on average, it's about 5,000 unique people every month. So you're able with this to kind of drill down to each month or the different types of services, as well as the maps. We can kind of see where all the people are coming from as well. In addition, the agencies and the programs, if you want to drill down even further. And then real quick, I'll switch over to the budget. So it's kind of the same information we were just talking about. You know, you can see which ones are kind of running hot and you're able to sort that. So if you did want to see in a nice like visual way which agencies, and it's tracking like every month what those invoices are. So you can also see if there's going to be some weirder months or if I think we're going to start to see it level out now as we're getting everything more dialed in. So if there's any questions on that.
Thank you. Great job.
Really
Thank
interesting.
you.
Yeah, really.
Yeah.
Oh.
Thank you, Caitlin. I just want to reinforce, I think I said this last month, but you know, Caitlin puts the dashboard up there, but the team works really hard and our community partners work really hard to pull all this data together. And it's been a successful collaboration because ultimately we're gathering the data that will, you know, prove very valuable in the future to target our funding. So thank you for all that. Kate?
Oh, yeah, sure. Okay. I'm pleased to report I've submitted 2 required financial reports to the state. First, our audited financial statement from fiscal year 24-25, which was presented and approved by the board last month, has been submitted to the Auditor General. This fulfills the district's requirement as outlined in section 10.558 Rules of the Auditor General. Additionally, I completed and submitted the district's annual financial report to the Department of Financial Services pursuant to Chapter 218.32 Florida statutes. And then over the last couple months, I've been working with Don and Shannon, helping them with the development of a capital assets policy. Basically, what I've done is worked to create a comprehensive accounting of the district's assets. And I've gone to our buildings, I've looked at the lifespan of roofs and AC systems. So I'm working to create a schedule of that we'll keep internally. It will be referenced in the policy. It won't actually be attached to the policy, but that has been some work. Also, I obtained several bids, and we have now scheduled a floor replacement for the district offices. I'm sure you're all familiar with the issues in the conference room. So we're replacing that along with 2 office suites. The repairs are going to begin on February 26th, and they're expected to take about 4 days. So during that time, staff will be working remotely. However, you can still reach us as normal through the phone, email. I'll be probably in the office monitoring the work that's being done. So lastly, I continue to monitor the current legislative session. There was quite a bit of traction today, actually. I was watching a lot on the Florida channel. So I anticipate receiving information from FASD either Friday or Monday. Some of those active bills had some amendments done, and I know one has advanced. So we should see where we're kind of going to end up on this with property reform. Any questions?
Kate, would either of the agencies that you just sent materials to be interested in the AUP that we just looked at yesterday? I just think it's an interesting document that just furthers,
Shows, right.
it drills down and shows how hard we're working, both on the process and,
So I believe
it's
Jenny
an interesting document.
does
It's
work
an
with
audit.
agencies to give them that. I have copies, so I can work with Jenny, and we, of course, can send
I'm
that.
not sure anybody looks at it once you send those things, but after discussing it yesterday, I'd love
Yeah, I know in
somebody to
years
be
past
taking a
we've
harder look.
provided them too. So absolutely, we're happy to
Yeah.
send those reports out.
And if I may, before I read my story, I do want to take a minute to acknowledge when, one of the things that, our job titles are our titles, and there's a lot of other things we all do too. But I want to acknowledge the fact that I just realized as I'm copied on all these emails, but Kate's the one who does the work. And when it comes to submission, whether it be something related to trim for the county, the state, paying money to the county, everything, all the government interactions that we have, which the ideal is perfection and being flawless. But we all know as human beings that's unrealistic. However, I do have to say that in the 11 years that Kate has been responsible for this, she's nailed it every single year with every single report, everything. It's on time or it's early. And I think that's worth just commending her on, because I mean, that's really not the expectation, but in her mind, the expectation is perfection, so she makes it happen. But I just want to acknowledge her for that.
Thank you.
Thank you, Kate.
Thank you.
Okay, so we have a heartbreaking story tonight, as they are, and this is, we're calling this Antasia's story, okay, breaking the cycle. So Antasia's life began in instability shaped by generations of homelessness, addiction, and fear. Try to put yourself in this situation. If you've never had this lived experience, when you read through it and try to feel it, it's very powerful. Much of her childhood was spent on the streets, searching for food, clothing, shelter, often alongside her mother. School was inconsistent, and she never attended a full year of middle school. Her daily reality was survival, not stability, which we all want for our children. As a mother, Antasia entered an abusive relationship. Pregnant with her 3rd child and caring for 2 small children, she was forced from her home and returned to life on the streets. She has shared that families experiencing homelessness are not truly living. Instead, they're hiding, and many are afraid their children will be taken away. She would tell her son they were camping, quote unquote, when sleeping in the woods, and sometimes sought shelter behind churches or in abandoned sheds. With only a small rusty wagon carrying her children and her backpack of clothes, Antasia arrived at Hope for Families Center, determined to change her future. Through the safe housing, structured support, and coordinated services made possible by funding from the Indian River County Hospital District, Antasia began rebuilding her life. She received help during the birth of her baby, daycare for her younger children, and case management support that allowed her to focus on stability. She started working toward her high school diploma and secured employment as administrative assistant. It's a different story today. Antasia is living independently in her own apartment. She's gainfully employed, confidently managing her family's needs. She remains closely connected with safe families to ensure her children receive consistent medical care, including specialized therapy for her daughter, who's on the autism spectrum. Antasia's story shows what becomes possible when families are given stability, support, and opportunity. Because of the district's investment in Hope for Family Center, Antasia is building a healthy, secure future for her children and permanently breaking the cycle of generational homelessness for her family. So thank you to Hope for Family Center for that story. Madam Chair, that concludes my report.
Much. Any other questions from the trustees regarding? Dr. Mackett, would you, I'm sorry, we're doing Tykes and Teens first, so you can stay. Ann Posey, CEO of Tykes and Teens, welcome.
Thank you. I'm going to come over here where I'm not laying on the monitor.
Okay.
Good afternoon, and thank you for the opportunity to share our semi-annual report from Tykes and Teens Children's Mental Health. On behalf of the agency and our board, we want to thank and express our gratitude to the hospital district for your support and the trust you place in us to provide children's mental health in our community. I'm going to briefly walk through the 4 questions that you ask us to address, and then I can certainly take some questions should you have some. Over the past few months, we've had 2 major learnings that are shaping how we operate moving forward. First, shifting to a fee-for-service model has shown us just how fragile revenue can become even when small disruptions occur. School holidays, staff leave, and vacancies, all these create immediate drops in services to children. In 1 quarter alone, school closures meant that we missed 160 visits with children. That reinforced something very important to us. We need to do a better job of monitoring the ebbs and flows and also discuss with our partners the impact of these disruptions on services. We need to strengthen our referral process and accelerate intakes, which is clinically sound as well as essential for our financial stability. Workforce vacancies have a much deeper ripple effect than we anticipated. If a clinician resigns with a 2-week notice, we know it will take often 6 months to fully recruit, onboard, and get a new clinician functioning independently. This is pushing us to invest more intentionally in retention and cross-training so we can weather these transitions more smoothly. Second, as we wind down our funding for our mental health consultation program, one of the biggest lessons we're taking with us is what this experience has taught us about prevention. We've realized we have to communicate more clearly and more often that prevention is healthcare. Prevention builds the skills and environments that keeps children emotionally regulated and socially connected. It reduces behavioral crises, reduces the need for intensive services later, and strengthens the whole system before problems escalate. This is healthcare. And we've learned we need to tell this story more boldly because when prevention gets overlooked, communities lose the very foundation that keep children healthy in the first place. So what didn't go as planned? We did face some challenges for sure. We had significant staffing turnover in Indian River County, more than expected for reasons outside our control. For instance, a long-tenured employee experienced a family tragedy and resigned due to the mental health aspects of that tragedy. We had a clinician who was pregnant go out on maternity leave 2 months earlier than anticipated, and a new hire who had to resign almost immediately due to an unexpected family illness. These disruptions really highlighted for us the vulnerability in the current staffing structure. Going forward, we're going to continue to expand our recruitment efforts and continue to build our financial reserves so that we can absorb these gaps. Certainly, the second thing that didn't go as planned was the 50% reduction in the sunsetting of our mental health consultation program. This meant for us, we immediately eliminated a position in Indian River County, and we shifted into rapid grant-seeking mode to stabilize the program in this county, which we consider very important. But more importantly, it underscored the need for us to continue to communicate how prevention fits squarely within the continuum of care and how early intervention reduces healthcare costs moving forward. This will be a major advocacy focus for us as we move forward in our journey. Emerging issues that we're looking at across the broader spectrum. Obviously, we're monitoring conversations around property tax and sharply reducing or eliminating non-school property taxes. This would directly impact, as you know, special districts, which not only in this county, but in our other counties through Children's Services Councils fund us heavily. We also are monitoring the shift in philanthropic giving. There are declines and changes in donor priorities and increased demand for dollars from philanthropy as grant funding becomes more challenging. Potential for Medicaid cuts and Medicaid caps on service are certainly something that we're watching and monitoring, as that could impact services that we provide to children. And we continue to have challenges recruiting and retaining specialized mental health providers. And we face the growing reality that many of these healthcare workers simply cannot afford to live in the communities that they serve. All of these forces combined make it more difficult for organizations like Tykes and Teens to remain stable while the demand for services continue to rise. But what will look different about our organization over the next 5 years? We expect to evolve in a few key ways, and this was a very timely question given that our board is engaging currently in strategic planning. So I really came with some things from our strategic planning session. We plan, obviously, to continue to diversify our funding even further. We want to grow our reserves and adjust our priorities as the external environment changes. We really anticipate deeper collaborations with other nonprofits to reduce duplication of services and ensure that our limited resources go as far as possible. And we plan to stay tightly connected to community health assessments and local planning efforts so that we remain aligned with the most pressing needs in our county. In short, 5 years from now, we expect to be financially resilient, more collaborative, and even more responsive to emergency community health trends. So thank you for the opportunity to share this update, and I'm glad to take any questions.
Questions from trustees?
The one that came to mind, I mean, the school, I get some of these things are out of your control, but the calendar is set, so I don't know how you get.
It is, so we provide services in the schools to children in the schools. These are children that have difficulty making it to the office because of a variety of reasons, and so we go into the schools to see them. So when the schools close, those children don't get services often. We offer for them to come to the office. We offer telehealth visits, but a lot of times it's just not accessible to them. And we work with our partner at the school district. We have a strong relationship with them. But for instance, after Christmas break, a couple of the schools said, we'd like to give the kids a week or two to settle in before you come back in. That directly impacts our ability to provide services.
That explains where the heart of my question was, because
Right.
you know the schedule.
Correct.
I didn't get how there are 160 missed, but that kind of thing.
And we are anticipating in the summer that, we'll see a decline in services as
Okay.
well. We see that traditionally. We've done better about looking for other ways to see those children in the after-school programs or the camps, but it is challenging.
This is not a criticism, but
Sure.
it sounds to me there's a learning curve going on with regard to fee-for-service.
Yes.
Prior to fee-for-service, you really didn't have to think about revenue when the schools were closed. Now
Correct.
you do.
Correct.
Okay.
Yeah, so that's a learning
And it's
for
an
us.
adaptation, finding another way. Like you said, this is the first time you probably during that season explored the televisits and some of these other things.
No, we do that in other counties, but in other counties, our grant support is not fee-for-service, and it really helps us during those times.
But I'm talking
so
about
this
Indian
is-
River. Indian River
Right,
County,
so
you
this is
had,
different, and we're adjusting. to
right,
it.
Indian River County, you had not.
No, in Indian River County, previously, our grant support was not fee-for-service.
Right, and so you didn't do the telehealth
We did.
during the off-season?
Sure, we always have done
Good.
telehealth, but we're really pushing it for our, for the children.
Right,
in
this
the school
is
system.
training the families and education for everybody.
Correct. Yes, sir.
Any other questions?
right, thank you very much.
Appreciate you being here.
Thank you.
Okay, unfinished business. Dawn, from yesterday, you got some edits made to the policy as we
Yes.
asked?
Yes, we do. I wanted to take just 1 minute and just give a brief update. I asked Frank if I could just do it all at once instead of giving, two different updates. So just very briefly, just an update on audit and policy work that have been completed. So far this year, I have completed 10 audit site visits. The visits continue to provide very valuable insight into agency operations and program delivery. They help ensure alignment with our funding expectations and our accountability standards. I finalized and distributed 2 audit reports to the trustees last week, Samaritan Center and Mental Health Collaborative. If anybody has any questions, please feel free to reach out via email or call me at the office. I'd be more than happy to discuss with you. In addition, I also revised our pre-audit letter. That is a letter that is sent to all new agencies that are applying for funding through the LOI process, as well as existing agencies that are proposing a new program or service. So that pre-audit letter will go out to each LOI that is submitted, along with a questionnaire for them to fill out. Finally, I have worked on the revisions to the funding application policy with our team. It did go to legal for review. Dana did send it back to us this morning. It was emailed out to the trustees this afternoon, but there is also a hard copy at each dais for your review and hopefully approval. And I would be happy to answer any questions the trustees may have.
I had raised several topics, issues, moments yesterday. I looked at them, they're all covered.
Okay,
But I
perfect.
probably paid less attention to other people's concerns, so.
I can't remember all the changes
Yeah.
at all, so.
We captured them, we made.
Yeah.
Yes, we
Yeah,
did
no, it
capture,
looked-
we
it
did
looks good
capture
to
the
me.
changes.
Oh, I know you had a couple. But We're good? Okay. May I ask for an emotion to approve?
So move.
Second?
Any discussion? All in favor?
Aye.
Any opposed? Thank you very much.
Nice quick turnaround.
Thank you, Dawn. Appreciate
Thank
that.
you.
Okay, now, anything else before we move into new business? Okay, would you like to excuse yourself? Okay. See if he gets back in. Okay, so welcome, Caring Center for Women. Jerry, thank you for coming today.
Yes, I brought my wonderful helper with us today. She actually does all of the billing, and I think this staff will agree that she does a fabulous job. She works very hard at it. So I'm going to let her present first for us.
Thank you.
Right. Good afternoon, trustees and district staff. My name's Josie, and as she mentioned, I do all the reporting to the district staff regarding our monthly invoice and records and such. First of all, I wanted to thank you for the continued partnership with the Caring Center for Women in our Bridging the Gaps to Women's Healthcare program. We're very grateful for the district's fiscal year 25-26 award of $350,000 and for the careful consideration given during the application process. In our original request, we sought $420,000 and projected approximately 2,400 billable encounters. The district awarded $350,000, citing lower utilization in the prior fiscal year. As we discussed during the approval process, that prior year utilization did not reflect true demand. We were on a fee-for-service model last year, and it was significantly affected by the eligibility verification process, which limited our ability to invoice for many of the services that were already being provided to district-eligible patients. We reviewed last year's fiscal service volume, and without those verification barriers, we could have invoiced for over 3,865 visits. Those services were delivered to Indian River County residents, that simply could not be invoiced under the prior fee-for-service model. With the removal of that barrier for this fiscal year, invoicing now accurately reflects the care that is being delivered. And based on current trends, we expect approximately 4,000 total encounters to Indian River County residents accessing care earlier and more consistently. This increase is a positive outcome. It reflects improved access to care for uninsured and underinsured Indian River County residents, increased community awareness of our services, and expanded referrals, including from Partners in Women's Health, who now directs all initial pregnancy tests to our center. As of early March, we anticipate that the district's $350,000 allocation will be fully exhausted well before the end of the fiscal year. Through the Bridging the Gap in Women's Healthcare program, we provide pregnancy testing, diagnostic ultrasound, nurse practitioner visits, laboratory testing, STI screening and treatment, early prenatal care with the goal of the first 6 visits, and comprehensive women's wellness exams. These services are essential for confirming pregnancy viability, accurately dating gestation, identifying complications early, managing chronic conditions, and establishing appropriate care plans, all of which directly support healthier outcomes for mothers and babies. This is medical care delivered in alignment with accepted standards of women's health and obstetric care, serving uninsured and underinsured Indian River County residents who otherwise face significant barriers. The need for early prenatal health care has been clearly affirmed by the community. During the district's August 2025 Town Hall and Community Survey, maternity services were identified as a necessity for public health and safety. The Indian River Community Foundation's 2025 Community Needs Update further highlights that nearly 30% of pregnant mothers do not receive prenatal care in the first trimester, reinforcing the importance of accessible, community-based services that engage women early in pregnancy. Based on these utilization trends, we are respectfully requesting additional funding of $560,000 to support district-eligible services from March through September 2026. This will allow us to continue providing uninterrupted prenatal and women's healthcare services to Indian River County residents through the remainder of this fiscal year. We remain committed to transparency, detailed reporting, and ongoing collaboration with district staff, and we appreciate the continued partnership in expanding access to essential women's healthcare services in Indian River County.
Thank you.
We have learned the need for these services in this community are only growing. We have made plans. We have a wonderful board of directors here in Indian River County, all pillars of the community, and they have supported this project from day one. And I brought my own Vanna White with me today so that he can show you a rendering of the future of a caring center for women in this county. And we expect to close on this property any day now. And that will allow us to see the number of women that are currently coming to us daily. And they come to us because there's nowhere else for them to go. And we are, at this point, in February 19th, I think, we're at 89 pregnancy tests already this month. So our numbers are only climbing. They are not, this trend is not stopping. And we have to be here for these women and these babies. So again, as Josie said, we thank you so much for helping us, for standing beside us, for supporting all of the women and babies in this county. It's been a wonderful partnership, and we are dedicated to allowing any changes you need. any way that we can continue this service in this county. It truly is that important. So did you have any questions, I'm sure?
Trustees?
Great.
Trustee Deagle?
Just looking at the numbers that you're asking, so you originally asked for 420,000, and that was going to, you were doing a projection of 2,400 billable encounters with that. That was your original.
We were wrong.
Pardon me? Yeah,
We
yeah.
were wrong.
But that works out to be about $175 per person. Is that what they're billing us, 175?
195.
They're 195.
For-
Okay.
Go ahead. I'm sorry.
No, so, because the 420,000 divided by the 2,400 is 175, so I don't know where the 195 is coming from. So you're asking for an additional 560,000 in addition to the 350,000 that we
Correct.
approved. So that would bring you out to about $910,000 for us. You just said in your letter that you're expected to do approximately 4,000 total encounters this year.
Mhm.
And the 4,000, I guess I did by 175, came out to 700,000. I did not do it to, or.
Yeah, when we initially put in at 175 or 173, that's where we were. But with Frank, we were able to increase that to 195.
Okay, so at 195, that 4,000 that you're expecting would come out to 780,000. Why are you asking for 910,000?
Right now, we figure we're on track for 4,100. And that's just based on where we're at right now. But again, every single month, those numbers have increased. And it was really based also on the amount of billing that we are currently doing.
Annualized projection.
Yeah, I just wanted to, like, I
Yeah.
have it in here, what they analyze at
And just
their,
remember that it's fee for service, so if they don't use it.
if they don't use it.
Right, if
Correct.
they don't
Okay.
get that payment.
Yeah, that was it. I just wanted to clarify the numbers, that's
Yeah.
all, and. what
One
I'm
of the
expecting.
reasons, that was an adjustment that was made when we met with them, that they were at 173 last year, and then this year, when we talked about the services that they were going to provide, and we looked at comparisons, it came out to about 195. So we did increase that.
I do have one other question. Can you, the simplified verification by by district staff, what did we change? I can't remember. She says a simplified verification process by district staff enabling appropriate billing.
It's the barriers for the application process that they were incurring.
Like, what were
weren't
they?
able to get the applications. They had submitted applications and into the portal, but they weren't able to get the documents that were required. So that wouldn't allow them to see and
Got it.
bill those patients.
Okay.
There were a whole list of services that are provided. Is a visit inclusive of all those things? Because I wouldn't think that would be necessary. Are all those services at 175, or are there a variety of fees, fee for service, that have been established for SDI testing versus
So
ultrasound versus?
195 currently. But that is, so what, I don't remember, I don't have my
Yeah,
notes.
let me jump in if I can, because we just had this meeting last week. So so I wanted to verify. So again, this is all based in our fee-for-service schedule. This is based in a medical visit. It's based, the foundation is the Medicare physician fee schedule reimbursement. So that's a foundation, just like it is for the others. So I wanted to sit down with the team and, Josie, the whole team came and we sat down and we went through. I asked the same question you did, Michael. I said, okay, so what happens, the pregnancy test, is there a medical visit? What happens during ultrasound? Who reads it? I went through every single one, and I feel confident that the time spent in the visit, the work that's done, and the clinical provider who's providing that service clearly justifies the 195. So it's not like someone's popping in, just getting a quick STI test, and we're paying the 195.
That's where,
Yeah.
you've answered that then.
And, yeah, and what is your bandwidth with your new facility annually? In other words, do you top out at 4,000 annually? What What's your
I don't think
capacity?
We'll have a number until we get into the new building,
Right.
what the bandwidth is. Right now, we're getting close to the cap in the facility that we're in, and we're actually going to start extending some hours to another day of the week so that we can provide more services where we're at until we get into the new building.
And if I'm understanding your relationship with partners, you're expanding their bandwidth and offloading some of their work,
Correct.
Right,
some of their work that we would probably getting billed for as well.
That
correct.
is correct.
Yeah.
Right. We were able to open up a lot of their appointment times so that their clients didn't have the big wait times. So they send them to us first.
Thank you.
Mhm.
Mr. Cooney?
Yeah, that's a very nice report. Thank you, as always. What services do you provide in addition to prenatal care and pregnancy care? Are there other services that you provide that
Right.
would go again to Michael Kent's question and others of the fees?
Right. We also have women's wellness, like a yearly exam. Then we do all of their blood work, their pap smears. Most of our clients have never had a yearly woman's exam. When we ask them, when was your last exam? Never. So we've been able to stand in that gap for them also. And we've found many very serious cases, cancer, things like that, that would have gone undetected had we not been there to do the women's wellness.
And am I correct or not correct that you also receive funds from individuals like myself for ultrasound testing and other that you?
Private donors.
Yes,
We're,
separate bill.
we're constantly fundraising. As our treasurer says, if we're not fundraising, we're planning to go out of business. So yes, we do reach out to donors also. Right. And I write grants for certain things whenever I can. One thing would be our shopping boutique, where the pregnant women can go to get their cribs, their car seats, their strollers. So I write one grant every year that helps me fund that.
And that's in the billing we do, the fee for service is completely separate from all those.
Absolutely separate. Right.
Michael?
One question's easy, just how much square footage are you in now and what are you going to have in a new facility?
Okay, right now we're at 4,900, I believe. In our current building, we've had 3 expansions. Every time we expand, our numbers explode. So we expect this to happen again. In our current situation with a new building coming on, that's 8,256 square feet. So it will be considerably more. And we plan to really expand everything.
Which leads to my second question, and this would have been in the application when we looked at it.
Okay.
Just talk a little bit about your medical staffing.
My medical staffing, I am so proud of our medical team. At this point, our professional providers, I have 3 APRNs. 2 of them have over 30 years experience in labor and delivery with Cleveland Clinic. So they knew all of the Cleveland Clinic doctors. If they have any questions, if we need referrals, they have personal cell phone numbers. They pick up the phone and get an answer immediately. We have 2 RNs on staff and 1 medical assistant. I have a medical receptionist, and I have 3 RDMS ultrasound technicians. All right, we don't train nurses. We use certified RDMS ultrasound techs. In addition to that, we have Josie, who does all of our billing. She works closely with them almost on a daily basis. We're very careful and very transparent with all of our billing. We also have a records tech that sends, after we see somebody, if we need to refer them out, or when our prenatals are ready to be handed off to Cleveland Clinic's OBGYNs, then there's a transfer of all of the medical records so that they can pick up right where we left off. So that's a big part of our daily operation too, is keeping those records up to date and going. We also have one office that we partner with Healthy Start, and they provide us with a maternity navigator. And after a prenatal appointment, we ask the moms to go in to see Valeria, who is bilingual, and she makes sure they're signed up for Medicaid for pregnancy, WIC, and any other service that they need, which is usually extensive. So we try to be like a one-stop shop. When the women leave us, we want to make sure that they're entitled to everything that they can get, and that they have access. Some of them have trouble, filling out the forms, trouble with internet, computers, that kind of thing. So we take the time to work with them on that also.
Do you have the ability to bill Medicaid?
No, not at this time. I hope that's a whole nother.
It's a whole other problem, I guess, maybe. But
It is.
there's something that I think we're working toward, is having our agencies, wherever, looking at our county's healthcare needs as a singular pot, and looking for anybody who can help us put money in that pot to do so. And that would be including our funded agencies that have the ability to bill insurance when available, bill Medicaid.
All right.
If I may just add to that, I just want to add that this is part of the application process this year. So the question is, if you have clinicians providing clinical services, are you set up to bill? Because that was a follow-up from last year and an expectation going forward, that if you have clinicians who are able to bill, yet they're not credentialed and your site's not set up with CMS, it needs to be.
I would suspect that you're to scale point at this point, that you probably could absorb that.
Well, I will say
Not to tell you how to do your business, but
the women that come to us, though, are uninsured. They don't even have Medicaid. So by the time we get them situated with Medicaid is usually when it's time to hand off to the OBGYN. So that would, that would probably be an issue for us time-wise, because by the time we get them set up and they get approved, it's time that they've moved on.
And they can't backfill.
Right.
Well, that's not necessarily the case. I think probably the smartest move would be to get set up with your site set up with CMS, because once you're credentialed to see Medicaid patients, you can Medicare, Medicaid, you can backfill. So I would definitely look into it. Yeah.
Okay.
Thank you.
We really appreciate the passion for the work that you do and the really good work. I hear some frustration from you all about our decision last year. I would just say that we're not perfect. The district is not perfect. We used the information that we had at the time and made that decision based on the data, and et cetera. But you're here today asking for, and I think you hear support. So please know that we do too believe this is a partnership. And we are grateful for the work that you do, keeping our women healthy in this community.
Thank you.
Thank
I
you, Karen.
assure you, we work very hard at it.
Yeah, my name is John Rourke, and I'm the treasurer. Just want to make one last point, is we have a doctor of record who is a radiologist who reads every ultrasound we do. He does this on a volunteer basis. Someday we're not going to have him. So someday we're going to have to pay for a radiologist to do the work he's doing, which is voluminous. As a matter of fact, he's a year younger than me, and he's getting tired.
Right. Any other questions from trustees? May I have a motion?
I move that we provide the funded request of the additional $560,000 for this fiscal year based upon the request and the fee-for-service relationship.
Second.
Any discussion?
You want to call for public comment before you vote?
Okay. Any public comment? Hearing none? All in favor?
Aye.
Aye. Any opposed? Right. Thank you very much.
Thank you.
Thank you.
Any other business? Oh, okay, she's got it. Any other business, Dr. Macca, from you?
No, ma'am.
How's the hallway? Okay, very good, very good. Any public comment? Hearing none? Meeting adjourned.